Well, I know a lot of people sometimes do several different nose jobs. What would make a person want to repeat a nose job?
You know, sometimes a nose is difficult. Sometimes the nose has had trauma before. Sometimes the surgeon who has performed the rhinoplasty did not give the patient an optimal result. And sometimes a patient wants perfection. So there are a lot of different reasons why somebody could have had a nose job and was not happy with it. Somebody who's had a previous nose job has scar tissue, can have a challenge in the blood supply. So it could be a little bit more challenging when you're redoing a nose or you're doing a secondary nose job. And for that type of operation, the patient has to really seek a plastic surgeon who does secondary or corrective rhinoplasties on a regular basis.
So do you do corrective rhinoplasties?
Yeah, I do a lot of them because we do have a lot of patients who come who've had noses done before in different countries. We have a lot of people from the Middle East, from South America, from Europe who have done them in their native countries, or just simply here in the DC area who are not happy with their results, or they still cannot breathe properly after their nose. So we do a lot of secondary rhinoplasties. Those patients need to take the time to understand what's involved and the fact that there is a little bit of a higher risk than when they do their noses for the first time.
Well, now I know that there's a lot of different changes that you can make to a nose, as it has the bridge, the septum. But can you just focus on fixing the bump or the septum or the tip?
Sure. And that's where the patient needs to articulate their needs to the plastic surgeon. I typically meet with patients on 2 consults before the surgery, at length, talk to them, show them before and after photos, discuss with them their nose, discuss with them the maneuvers, what they're not happy with, and come to an agreement long before I get to the operating room as to what we're going to do, and make sure that my vision of what I would like to do for the patient is exactly the same as the patient's vision as to what they want done to their nose. Nothing more and nothing less. And that's where you get a winning combination and a very happy patient.